Welcome. I am Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and welcome back to Plastic Surgery T&A. That's Talking Advice. And again, I am your host, Earl Stephenson Jr., Atlanta plastic surgeon with nearly 20 years of experience. And we're here every Saturday to shed truth and transformation. If you are rejoining us as you usually do on Saturday or over the weekend on YouTube, then welcome back. If you are new, welcome. I expect new users and old friends to the podcast to really do be two favors. New users, you can subscribe and like. New users and old friends of the podcast, please share. It really is helpful to the channel. I say this every time, but it really helps me build the channel and help spread the word. This may be helpful for someone if it's not helpful for you. So with that being said, all the formalities are out of the way. Today, I'm going to talk about liposuction. Liposuction is an old technique, and people really talk a lot about liposuction. People are grabbing their waist, their hips, their chins, everything, and they're pinching fat, and they're like, I just really need to get some liposuction, and I can just get it anywhere by anybody. So that's not true. What I want to do today is to kind of demystify liposuction a little bit. I want to hit on a couple of things. I want to give you the history of liposuction, where it started and where we are today. I want to give you the 7 or 8 misconceptions about liposuction so we can get you on the straight and narrow. And lastly, I want to talk about the 5 techniques of liposuction, because you hear all types of liposuction and it gets confusing. Even gets confusing sometimes for plastic surgeons, because a lot of this can be marketing. So we want to talk about tumescent liposuction. We want to talk about laser liposuction. We want to talk about water assisted liposuction. We want to talk about ultrasonic liposuction, and then we want to talk about radiofrequency liposuction. So we're going to talk about the history of liposuction. We're going to go over some misconceptions, and we're going to finish out by trying to make an understanding or get an understanding of the lay of the land of what's out there and what it's used for. So let me start with a brief history lesson. So liposuction kind of became a procedure in the 1920s. It was a French surgeon called by the name of Charles Dujardin, who attempted, and I hope I pronounced that right, fat removal procedure. This was really archaic. The procedure wasn't really a great procedure, and it really ended poorly. It led to a lot of complications, even though this doctor tried to push this technique as a way to remove fat and contour bodies. But it really fell under a lot of scrutiny, and this doctor got a lot of negative press, and basically liposuction kind of fell to the wayside in the 1920s, as you think it might have. Fast forward to the 70s, there were some guys in Italy. There were some docs. They were actually gynecologists. Dr. Fisher was a doctor who really kind of started to bump up the game in liposuction. He used thin little cannulas, or like metal straws, to help suction fat. That really laid the groundwork for what we do today. We still use metal straws of different diameters to help contour people's face and body. So he was really the godfather of that. So Dr. Fisher, Italian gynecologist, was one that kind of laid that groundwork. Fast forward to the 80s, a French surgeon named Yves Girard-Hilou and Peter Fournier really kind of upped the game of even Dr. Fisher's technique. Not only did they use small cannulas, but they injected fluid in the area that they were going to contour, and that fluid contained 2 things. And it still contains basically 2 things today, even in modern day liposuction. It contained, number 1, local anesthetic, and it's lidocaine usually. It can be different things, but usually lidocaine. and it contained adrenaline. And adrenaline helps reduce bleeding and blood loss, which made the procedure immensely safer. It was easier to remove fat, it was safer to remove fat, and it was more comfortable to remove fat. So these guys really took liposuction to the next level in the 1980s. Fast forward maybe 5 or 10 years between the 80s and the 90s, Jeffrey Klein. He really is the guy who's kind of the modern day guru, or kind of the true godfather of modern liposuction. He revolutionized it with introducing the tumescent technique. And that's really kind of the gold standard of liposuction. It really involves injecting that fluid that we talked about from Dr. Fisher and Dr. Fournier, and it injected it in large, or he injected it in large volumes. It was injected in the area of concern. Let's say it's your love handle. And it was injected to that area was kind of firm and tight. And that's why they call it tumescent, meaning tumescent means swollen. This allowed really for a lot easier procedure of fat removal, and even safer liposuction because the blood loss was even less. So tumescent liposuction, which is the gold standard of liposuction, was really championed by Jeffrey Klein in the late 80s, and we still use it today. I use it today. I love tumescent liposuction. It is, again, the groundwork for all other technologies of modern day liposuction. With that being said, tumescent liposuction, which is the injection of lidocaine or local anesthetic and adrenaline, which reduces blood loss or it reduces bleeding, started a cascade of how can we make this better? Can we melt the fat? Can we try to tighten the skin? And this is where all these innovations have come to pass. Excuse me. Starting in the early 2000s, we had laser assisted lipo, smart lipo, slim lipo, and I'll talk a little bit more about that. And then I think we had the next version of technology to layer on top of laser lipo is ultrasonic liposuction, and that's called vaser liposuction. And then building on top of that, we started to get water assisted liposuction. Now, I've not used this, but it's called Body Jet. And you can use water assisted liposuction. It's a little gentler, but that was a new technology on top of vaser. And then you start to get in, as we kind of ease into where we are in present day, radiofrequency assisted liposuction, where the skin and collagen were tightened with the use of radiofrequency. Again, we'll dive a little deeper into each of these. And that's been kind of marketed as Body Tight, Renuvion. I think the latest version of that is J Plasma. Don't quote me on that, but that's where we are with that. So that's the technology that has kind of been built up into present day from tumescent liposuction. So there are some misconceptions about liposuction. Liposuction is not, first and foremost, number one, is not a weight loss solution. You cannot use it to reduce your weight globally. It really is a contouring procedure. It's for contouring stubborn areas of fat that are resistant to changing diet and lifestyle. So with these stubborn targeted areas, we can remove fat through liposuction. So number one, it's not a global weight loss solution. You need to change your lifestyle, whether that's diet and or including exercise, and seeing your physician if you have other medical conditions that can improve and maintain a stable weight. Number two, lipo results are permanent. Yeah, no, they're not really permanent because you can change the liposuction results. You can have liposuction of a couple of targeted areas, but if you gain weight, you're going to increase or change the contour of that area. And another misconception within that misconception, if I can use that, is that fat cells don't travel to the area of liposuction. If we have 10 fat cells in your love handles and I remove 5 via liposuction, then you got 5 left. And if you gain weight, then those 5 are just going to get bigger. If you lose weight, those 5 are going to get smaller. So liposuction results are not permanent. If you maintain a stable weight within reason, then the contour and result can be permanent. So it's really important that you come in with a good plan of healthy lifestyle and weight stability so that you can have your procedure and try to maintain that for a long duration of time. Number 3, liposuction is only for women. That is completely false. We all know that now. I think, through popular TV, through celebrities, and just through our friends and family, we know that liposuction is not only for women, it's also for men. In a particular area, it's great for men who have a little fat on their chest, and that area can be contoured with liposuction. And that's called gynecomastia surgery. Men can have liposuction of their love handles as well and of their abdomen to produce a more masculine figure or more masculine shape. So liposuction is not only for women, it's also for men. So that's just a misconception. Misconception number 4, liposuction is a substitute for a healthy lifestyle. We kind of touched on this earlier, but it's not. You've got to eat healthy. You've got to exercise regularly. That's got to be inbred in what you do on a daily basis. Liposuction is for those areas that are resistant to your healthy lifestyle that you want to contour in if you are a good candidate. So you cannot substitute liposuction for a healthy lifestyle. You cannot eat bonbons, lay on the couch, and figure that you'll just go get liposuction and get shaped up. It's not going to happen. It's not going to work. 5th misconception, liposuction leaves noticeable scars. Not really. Liposuction, at least modern liposuction, we use teeny scars. I'm going to try to point it out. I'm going to pull this pin up, see if I can get it closer to the camera. About the tip of that pin is about the incision length, maybe just a tad more of a liposuction incision. And they're small and they're placed in discrete areas. So I'll give you an example. For the face, if I'm going to liposuction beneath the chin, I put a little incision just in the shadow of the jawline here. I put a little incision at the base of the ear on each side, and I'm able to come across this way in liposuction. I'm able to come straight on in liposuction, and from those different angles, I'm able to really contour the chin. And then through tiny incisions. For your tummy, I put it inside the hood of your belly button. That's one incision. I put it down by your hair bearing area, one on each side, so I can get the lower part of your abdomen. Really small. On the back, liposuction in the back is a popular procedure. I used to put it in the middle of the bra line, and I found that scar is too obvious. It never really heals well. So I've done one or two things. If a person is fairly short, I'm able to put that incision just at the top of the butt crack, and then I'm able to reach up to the upper back through there and, of course, get the lower back. If I can't, then I put that incision and I'm going to turn a little bit, hit my dang mic, kind of right here. For those of you who are on the podcast and don't have the video, it's right kind of on the back side of your armpit on each side. And I'm able to liposuction the upper back through there on both sides, and I put an incision down in the upper butt crease, and I'm able to liposuction the lower back and love handle. So the scars are really, really small, and if you take care of them, put sunscreen on the area. Yes, you're probably saying to yourself, I'm not going to run around naked. You might be in Italy or France. I don't know. Well, you might be running around your house, but nonetheless, even if you don't, put on sunscreen. That will help minimize the sun's effects through clothing if you don't wear sun protective clothing, and prevent those scars from darkening. Sometimes we use tiny bits of silicone gel to help kind of keep the scar flat and thin. So those are some of the things that we can do, not necessarily all the time, but to help make these incisions less noticeable. But these incisions are really pretty noticeable in and of themselves because they're so small and they're in really discrete areas. So they do not leave noticeable scars. The sixth misconception is that liposuction can eliminate cellulite. We just, in my experience, and I wouldn't say challenge. I will take any opinion from any expert plastic surgeon who's got a good way to take care of cellulite. It's just not a really great way. There are some ways to improve it, but there are not any great ways to completely treat it, in my opinion, in my experience. But again, I'm putting myself out there as that I'm not the expert on cellulite, but I do know that liposuction does not take care of cellulite, not whatsoever. It also does not take care of significant loose skin. It doesn't tighten loose skin. So the misconception that liposuction can take care of cellulite and tighten loose skin is not right. If you have a significant amount of excess skin and fat, yes, the fat can be removed and that skin that used to be kind of plump can be thin, but the skin will only retract back so much from the liposuction. It still will be significantly loose. You can try to use some of the newer technologies that I mentioned before. And again, like I said, we'll get into the teeth of those in a minute, to help tighten that skin just a little further, either with radiofrequency or ultrasonic energy. But if you have significant loose skin, even with those technologies, it's going to be hard for that skin to come all the way back to your core and end up in a smooth contour. You really need some type of real tightening procedure. And what I mean by that, you need that skin removed and the remaining skin sewn together. That is the ultimate tightening procedure. So if you have a lot of tummy, belly fat, and a lot of loose skin, yes, liposuction can be done. It's not going to give you the best result. You really have to wrap your mind around having a tummy tuck, and not just a tummy tuck alone. I'm a firm believer that if you have that body habitus where you have a lot of loose skin, and extra fat, and you need a tummy tuck and liposuction is so much more powerful than liposuction alone or tummy tuck alone. So I would say in the majority of my clients, or with the majority of my clients, I usually perform tummy tuck with liposuction. Seventh misconception is that, hey, liposuction is quick with no downtime. False. That's not what's happening here. Don't get seduced by that. Liposuction is a surgical procedure. It's not an open surgical procedure, but it's a surgical procedure nonetheless. And what I mean by an open surgical procedure is not where we make a long incision and we kind of get underneath the skin and expose and look directly at it. It's a closed procedure where we make small incisions, inject fluid, and then contour kind of with feel and visualization. So it's a closed procedure, but it's still surgery. It's going to require some downtime and healing. There's going to be swelling. There's going to be bruising. There's going to be stiffness. There's going to be a little bit of fatigue, jet lag because of the anesthesia. So you have to factor that in. You cannot come in on a Thursday, have a liposuction, and expect to be up Saturday doing everything that you were doing on the Wednesday before, and be ready for a party, a gala, an event, you know, 3 or 4 days after. That's just not realistic. So, no matter if it's awake or if you're completely asleep, it's going to require some downtime, and you need to be prepared for that. And your plastic surgeon should help guide you. The last misconception is that, and that's number 8, that anybody can perform. It's easy. I see people on social media, from physician's assistants to gynecologists to ER physicians to family practitioners, who are doing liposuction. And I mean, can they technically do that? Sure, if they have the medical permission, either via a license to do that or some other mechanism. But are they really, number one, skilled? And do they know how to take care of complications if they occur? But most importantly, do they know how to avoid complications? And I'm going to be biased, of course. I don't think they do. Only a board certified plastic surgeon can, one, have the technical skill married with the training and expertise to avoid problems, to deliver reproducible outcomes, and to take care of problems if they were to occur. Those other practitioners really can't. They really can't. So don't be seduced by a low price from a board certified cosmetic surgeon who's really an ER physician by training, or really a gynecologist by training. So don't be seduced. So those are the misconceptions. So we talked about the history. We talked about the misconceptions. Now let's break down liposuction a bit. Let's break it down. We're going to talk a little bit about each technology and what it can do. So I think I'm going to start with laser assisted liposuction. That's the fancy $1 million word. It's commonly marketed as smart lipo and slim lipo. Probably 10 years ago, I purchased a slim or smart lipo machine, and I was seduced by it. And I found that, in my experience, that it really didn't tighten the skin significantly. And here's what it's touted to do. I got the cart before the horse. So let me put up the slim lipo slide, and you'll see as I can explain it. Again, it's targeted areas. It can be done if it's a very small area, in my opinion, like submental or underneath the chin, maybe a love handle on one or both sides, maybe even a small touch-up area. It can be done under PO sedation or oral sedation, slightly awake but drowsy. Some people do it completely awake. That's up to them. I don't think I would do that. And of course, it can be done under general anesthesia or twilight. So you inject the tumescent fluid, which again is the local anesthetic, and the adrenaline. You wait an appropriate amount of time for the local anesthetic to work and for the adrenaline to work. And then you've got a little flexible, a little metal straw or cannula. That's the medical term for it. And you make a little incision wherever you're going to make your incision. You place that cannula underneath the skin in the area that you're going to treat, and you deliver laser energy, either before you liposuction to kind of liquefy or melt the fat, or you can do it after the procedure, where that laser energy stimulates collagen and promotes tightening of the skin. So this is what happens. You get the patient prepared, you get them anesthetized with the Klein solution. They're either asleep or they're sedated. The Klein solution's in. You make the little incision. You either use the laser cannula to melt the fat, and then you still have to physically liposuction and remove the fat with a vacuum cannula to remove the fat, and then you're done. Or you can use the laser cannula again at the end to just run it right underneath the skin where you're treated to kind of get it to contract. And it's kind of the analogy with laser, with ultrasound and radio frequency to get the skin to contract. Think of uncooked bacon. Most people like bacon. You put it in a frying pan, you got it heated up, and as it cooks, it shrinks. Kind of the same concept. You're not cooking the skin, but you're adding heat to it to kind of get it to shrink. So that is the premise. So that's how you perform laser lipo or slim lipo or smart lipo. The results are okay at best. I don't really think it adds anything in my hands above the level which I can perform with just routine tumescent liposuction. So again, that's laser liposuction. It's really good, I guess, for areas like the chin or beneath the chin, some arms, you know, that's probably the areas that it probably is best utilized if you're going to utilize it. I basically have stopped utilizing it a long time ago. I just don't think it gives me the result I think it should. So that's the first one. That's laser assisted lipo, commonly known as slim lipo or smart lipo. The second technology is ultrasonic liposuction or ultrasonic assisted liposuction. That's termed or marketed as Vaser lipo. It's kind of a shaper. It's done under, I guess, again, local or general. It's the same procedure. It's always tumescent liposuction with these add-ons, basically. So you put in a little probe or cannula again that emits ultrasonic energy. And its energy kind of vibrates and kind of just breaks down the fat cells. It spares kind of the blood vessels. So it's pretty safe in that regard. And then once the ultrasound energy breaks down the fat cells and kind of somewhat liquefies them as well, then you go and you do traditional liposuction in your lipo. These areas are time you cannot add too much energy to an area, otherwise you will damage the overlying skin and create an injury like a burn. So you want to be careful and make sure that you apply energy at the right dose and for the right time duration. But again, I think it's really helpful. It's definitely helpful when you have a real fibrous chest of a man, to kind of break that up, to help break up that fat that's a little tough, or you've got a liposuction procedure that you're doing again, or you're taking care of a lipo procedure from some other surgery that was done years before, and you've got a little bit of scar tissue. So I think it's helpful in breaking that down and helping contour. So I definitely think it has some utility. Some people use it routinely for what we call liposculpture, where you kind of etch abs and do all types of things. You certainly can do that and use it. I don't think it's mandatory, but you certainly can do it for that as well. The third technology is water assisted liposuction called body jet. That's how it's marketed. I've seen this. People have presented this to me. I've never used it. I don't think I really have talked to any plastic surgeon that I'm friendly with in the Atlanta area that's used it. So I don't have any experience in this. But what the premise is that same thing, tumescent lipo, small incision. You use water in a cannula to gently kind of pulse and loosen and kind of dislodge the fat. It's kind of a gentler version of kind of disrupting the fat. And then you dislodge or disrupted fat is then liposuction traditionally to remove it. again, I guess its claim to fame is it's minimizes kind of what we call surgical trauma, or it's just gentle. It's just really gentle. Again, I've not used this. I don't have any experience in it. It's typically touted to be used in larger areas like the hips or the tummy or the thighs. Even some people will use it on the buttocks. But again, no experience of this. But it is something that's out there. So if you are talking with someone or talking to a practitioner and they talk about using water assisted liposuction or body jet, this is what they're talking about. And you will have some familiarity with it. Number four, we talked about the gold standard, and I've been dancing all around that. That it's tumescent liposuction. It's really what everybody does. It's basically injecting a large volume of fluid, as I mentioned before, in the desired area of contouring. It's the lidocaine with saline or salt solution and adrenaline injected in an area that's going to be treated to it's really firm. It's really kind of taut. And then you use a cannula of various sizes to remove the fat, break it up, remove it with a cannula that has, suction on it. You can do that just manually with just by using your hand and going back and forth. I like to reduce my fatigue level so I can be a little bit more precise and contour a little bit more uh, definitely or discreetly, or just sculpt more precisely. I usually use a power assistant device, which means that I move not like this, but I move like I'm playing a violin. And it's really easy, artistic strokes. And then the liposuction cannula is hooked to a handheld device where the metal straw or cannula is moving back and forth. So I don't have to do it. It's automatically doing that. And I'm just moving it into areas and guiding it. Again, much like I'm playing the violin. I really like it. I've used it for a lot of years, and it's really my go-to. I use tumescent fluid and power assistant liposuction. It's really great. It's got a great safety profile. It predictably removes small volumes of fat, large volumes of fat. It's good in basically any body area: chin, tummy, mons, arms, you name it. It's good for it. So that's, again, my go-to. Lastly, we talked about, we're going to talk about radio frequency. And radio frequency, let me take this down. Radio frequency is marketed as Body Tight or Renuvion or J Plasma. I think that's what it's at least called now. It might be J Plasma. Again, it's introduction of the local anesthetic or the tumescent. It's done on a general or local. You use a specialized cannula or probe that emits radio frequency, as you can see here in the illustration. And it tightens that collagen layer. It's the bacon in the frying pan. It tightens that, but it's followed by, or it preceded by, just regular liposuction. You get rid of the fat volume and you've got a little loose skin, and you try to tighten it by adding radio frequency. It helps remove the fat. It helps tighten the skin. But again, you have to remove ultimately remove the fat with traditional liposuction methods, with manual removal or using a power assistant device. And it really helps with skin that's a little bit more saggy to help it tighten up. It's good for areas like the arms. It's good for stomach. It's good for thighs, and it's good for neck, where you really want to kind of get the maximum amount of skin tightening that you can get. Does not require a large or a long surgical incision and physical removal of excess skin. So that's what that is for. So in summary, this is just kind of one of the educational podcasts. It's just presenting information, nothing salacious, nothing maybe even earth shattering, but it just information that you can have and you can tuck away, because I think everybody at some point has a little bit of interest in, contouring a chin, contouring a waist, and liposuction is really the go-to procedure most times. Obviously, you need to go see a board certified plastic surgeon, have an in person consultation, and that surgeon will evaluate your general health. He or she will evaluate the amount of fat you have in the area of concern, and they will evaluate the amount of skin looseness or tautness to see if, one, liposuction plus any of these other technologies on top of that would be beneficial, or do we need to move on to a removal or excisional type of procedure coupled with one of these types of liposuction? So again, we talked about the history, we talked about the misconceptions, and we talked about the five, technologies of liposuction. Tumescent liposuction being the ground layer or ground floor. Uh, we talked about laser assisted liposuction, which is smart lipo, where lasers used to kind of break up and melt the fat and even help tighten the skin. We talked about ultrasonic assisted liposuction, where that ultrasound probe emits ultrasonic waves and it breaks up scar tissue, tough fat, and then any of that scar tissue is loosened, help contour the area, and any dislodged fat is then removed with traditional liposuction. We talked about water assisted liposuction, which I have no experience, where it's a little bit gentler. The water is used to kind of dislodge any fat, and then liposuction is used to remove that fat and contour the areas. And then lastly, we talked about radiofrequency assisted liposuction in the form of J plasma or Renuvion or Body Tight, where radio frequency is used to dislodge or kind of even liquefy or emulsify some fat. And then, of course, really to try to tighten any loose skin. So those are the techniques. They may apply to you. They may not apply to you. You have at least a little bit of working knowledge after listening to or watching this podcast about liposuction. So if you're interested and you're here in Atlanta, or you're even not even here in Atlanta, you can do a virtual consult with me. You can do an inpatient consult with me. I would love to talk to you. You can simply dial my number in the office at 770-466-4700. You can always go check out my work on my website, and the link is there, or it's www.esjaesthetics.com. And I perform liposuction on all the areas that we talked about. Typically with tummy tuck, I always use liposuction. I usually do some lipo 360 that's standalone. If I do an arm lift, I typically add liposuction as part of that treatment, so to help contour the arm a little bit better. We have smaller procedures such as submental or chin liposuction that we can do in the office, or even very small areas like a little pooch of the lower tummy and a very fit but person or client that just has a little pooch, or even love handles as a little pooch. We can do that in the office as well. So if you're interested, please come see me. If you can't see me, but you're interested and found a plastic surgeon or a surgeon in your area, please vet that surgeon. Please make sure that they are board certified. And here's the link here. And if they're board certified, that's the first step. You've got the right person, at least initially. Look at their work, go talk to them, see if there's a connection. And if there's a connection and you like their results and they're board certified and you've read their reviews and you feel that they're excellent plastic surgeon, then maybe that's the person you go with for sure. Another caveat, if they are a member of the Aesthetic Society, that doesn't hurt as well. That means they're really dialed into staying on the cutting edge of, aesthetic surgery and aesthetic medicine. So that's a feather in their cap as well. So with that being said, I think I've kind of run out of time and almost run out of voice. I'm a little dry and tired here. It's been a long day, but I wanted to present this information about liposuction, talk about that a little bit more. If you've enjoyed this, leave your comments below. If you want to talk, I've left my information on the podcast. I will leave it below as well. So we look forward to talk to you. Please share, like, and subscribe to this podcast. It's Plastic Surgery TNA, Talk and Advice. I try to put it out every Saturday. It should be available after 11 a.m. Eastern Standard Time. And again, if you would share, subscribe, it would be of great benefit. With that being said, I hope everybody has a joyous and relaxing weekend. Be well wherever you are in the world, and we'll see you next time. Peace.